A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Within minutes, brain cells begin to die, making it critical to recognize the signs of a stroke and seek immediate medical attention. Early treatment can minimize brain damage and improve the chances of recovery. Here are 10 signs of a stroke, explained in detail. Number 1. Sudden numbness or weakness. One of the most common signs of a stroke is sudden numbness or weakness, particularly on one side of the body. This can affect the face, arm, or leg. Strokes often affect one side of the brain, which controls the opposite side of the body. If the stroke occurs on the right side of the brain, it can cause numbness or weakness on the left side of the body, and vice versa. This symptom occurs because the brain cells that control movement and sensation in the affected areas are deprived of oxygen and nutrients. If you or someone else experiences sudden numbness or weakness, it's crucial to seek immediate medical attention. This symptom can appear suddenly and should never be ignored. Number 2. Sudden confusion or trouble speaking. Another key sign of a stroke is sudden confusion, trouble speaking, or difficulty understanding speech. A stroke can impair the brain's language centers, such as Broca's area and Wernicke's area, which are responsible for producing and comprehending speech. Damage to these areas can result in slurred speech, inability to find the right words, or difficulty understanding what others are saying. If you notice someone suddenly becoming confused, unable to speak clearly, or having trouble understanding speech, call emergency services immediately. Time is critical in minimizing brain damage. Number 3. Sudden vision problems. Sudden vision problems in one or both eyes can also indicate a stroke. This can include blurred vision, double vision, or complete loss of vision. A stroke can affect the part of the brain responsible for processing visual information. When this area is deprived of blood flow, it can result in sudden changes in vision. Any sudden vision problems should be treated as a medical emergency. Prompt medical attention can help reduce the risk of permanent vision loss and other complications. Number 4. Sudden dizziness or loss of balance. Sudden dizziness, loss of balance, or trouble walking can be signs of a stroke, especially when accompanied by other symptoms. The cerebellum and other parts of the brain control balance and coordination. A stroke in these areas can cause sudden dizziness, difficulty walking, or a feeling of spinning, vertigo. If someone experiences sudden dizziness or loss of balance, it's important to seek immediate medical attention. These symptoms can increase the risk of falls and other injuries. Number 5. Sudden severe headache. A sudden, severe headache with no known cause can be a sign of a stroke, particularly if it is accompanied by other symptoms. A severe headache can occur when a blood vessel in the brain bursts, leading to a hemorrhagic stroke. This type of stroke can cause sudden and intense pain due to increased pressure in the brain. If someone experiences a sudden, severe headache, seek medical attention right away. This symptom can indicate a serious and potentially life-threatening condition. Number 6. Sudden trouble seeing in one or both eyes. In addition to blurred or double vision, a stroke can cause sudden trouble seeing in one or both eyes, which may present as partial or complete vision loss. The occipital lobe, located at the back of the brain, is responsible for processing visual information. A stroke affecting this area can disrupt the brain's ability to interpret visual signals, leading to vision problems. Sudden vision loss should be treated as a medical emergency. Immediate medical attention can help preserve vision and prevent further complications. Number 7. Sudden difficulty swallowing. Sudden difficulty swallowing, dysphagia, can be a sign of a stroke. This can include trouble swallowing liquids, solids, or even saliva. A stroke can affect the brain's ability to coordinate the muscles involved in swallowing. Damage to these areas can result in difficulty swallowing, which can increase the risk of choking or aspiration pneumonia. If someone has sudden difficulty swallowing, seek medical attention immediately. This symptom can pose serious health risks if not addressed promptly. Number 8. Sudden numbness or weakness in the face. Sudden numbness or weakness in the face, particularly on one side, is a classic sign of a stroke. This can cause the face to droop or become asymmetrical. A stroke can affect the facial nerves, leading to weakness or paralysis of the muscles on one side of the face. This is often noticeable when the person smiles or tries to move their facial muscles. Facial numbness or weakness should be treated as a medical emergency. Immediate medical intervention can help reduce the risk of permanent facial paralysis and other complications. Number 9. Sudden trouble walking. Sudden trouble walking, including stumbling, unsteady gait, or loss of coordination, can be a sign of a stroke. A stroke can affect the parts of the brain responsible for motor control and coordination. When these areas are deprived of blood flow, it can result in difficulty walking and maintaining balance. If someone suddenly has trouble walking, seek medical attention immediately. This symptom can increase the risk of falls and other injuries, making prompt treatment essential. Number 10. Sudden severe nausea or vomiting. Sudden severe nausea or vomiting, especially when accompanied by other stroke symptoms, can be an indicator of a stroke. A stroke can affect the brainstem, which plays a role in controlling nausea and vomiting. When the brainstem is damaged, it can result in sudden and severe nausea or vomiting. Severe nausea or vomiting, particularly when combined with other stroke symptoms, should be treated as a medical emergency. Immediate medical attention is crucial to prevent further complications. Recognizing the signs of a stroke and acting quickly can make a significant difference in the outcome. If you or someone you know experiences any of these symptoms, it's essential to seek medical attention immediately. Face drooping, arm weakness,